We understand that there's a large percentage of the audience are from a health and safety background. So no doubt a very large percentage of you are familiar with the hierarchy of control. So what we've essentially got here is the NIOSH model that has been adapted for health and wellbeing. Essentially, what we're finding when we're going into new clients, generally we're finding that they're not taking a risk-based informed approach. And the issue with that, or the challenge with that, is that when they're asked why they've focused considerable time, energy and effort and spend in terms of health and wellbeing strategy and programs, they actually haven't got an underpinning of risk and data that's actually driven those decisions. And so the issue with that is that those programs potentially have taken a lot of time, energy, effort and money, and they're not directed in terms of where the focus really needs to be from a risk perspective. And so we're asked to come in when they're challenged by high turnover, high levels of bullying, their site claims are going through the roof in terms of cost and duration and sheer numbers, where they've had high levels of team conflict, for example, and they're at a quandaries to understand what are driving, all of these things and poor engagement scores overall. So what we certainly encourage is taking that risk-based approach and using the hierarchy of control to quantify and qualify the strategy in terms of it being a risk-informed approach with a 2 to 3 year roadmap, and prioritising and focusing on what really needs to be focused on and worked on from an organisational perspective, a team perspective, and then an individual perspective.
Yeah,
Thanks, Mark.
Great, Kate. And I think how that typically plays out in a workplace is that organisations often default to training or EAP for some of those lower order controls, rather than organisational design, team effectiveness, and the root cause, if you like, of why they're coming up with some of the results they are.